This is Preachuk in conjunction with PurePharma. We're going to be learning how to do the hip crossover stretch, which is part of our posture recovery exercise series. And I do recommend that you have a block or some kind of padding around in case you're unable to get into the demand I'm about to show you. This is going to give you a nice way to modify the exercise if you should need. Alright, so I'm going to set up the exercise. What you want to do to begin with is ensure that you've got about 6 inches apart at the feet and the knees. You can use that yoga block to assess that correctly ahead of time. And what I'm going to do now is place this over here so in case I need it. Now, once you've got that, you're going to roll yourself down on the floor. You might have to slide your feet in a little closer. Please pay attention to the position of your neck and your head. So if this is starting to arch up really excessively, put some padding underneath your head so you can lift it up, actively drop your chin down, and we're bringing the head and the shoulder and hips into a better alignment. Once you've got that, the exercise is movement of one hip going through external rotation. Now, a common mistake that's going to happen here is that you're going to swing the hip out. We want to make sure that that doesn't happen. So we're really just moving this femur in the socket. So we're going to take one leg up. We're going to focus on rotating out. And the incorrect positioning is this. All right? So if you're unable to get into this demand, we're going to give you an alternative link to the exercise that you want to put in place of this. So we're going to feel that femur rotate in the socket. You're going to clear your ankle on the outside edge of that base leg that's staying on the floor. You're going to sweep your arms out to 180 degrees. Now there's a palm up position and a palm down position. And I recommend that on the first pass you do your palms up, and then when you switch sides you do that one palms down, and the next day you could repeat that. Start palms down, palms up kind of idea. From here, focus on your hips doing the rotating, letting your pelvis and your spine respond. You're going to pull them away from the top leg. So if I have my right leg crossed on top, I'm going to pull my legs to the left. So you're going to pull that over, and you're going to turn your head and look over the opposing shoulder. Now some of you are going to run into what I call a brick wall, and so you might not get your foot all the way down. Now I'm going to just come out of this demand real quickly. This is where you could have the yoga block placed, okay? And so that as you come through that rotation, you could just place your foot down on a block, and then over time it could get lower to the floor. And this is a nice modification for this exercise. You want to hold this for about, I would say at least about a minute. Things that you want to work on. Think about gliding this long femur bone away from the center of your body. So that's increasing the extension through your thoracic cage, and we've actually created lumbo-pelvic stability here. You want to work on nice diaphragmatic breathing into the width of the ribs, gliding the shoulder blades just gently down. It's not aggressive. Okay. After about the halfway point of the exercise, think about opening the distance in your hip. It'll feel like you're pressing your belly button slightly forward towards your feet or your knees. To get out of the demand after you've finished your at least a minute, you could possibly stay in a little longer. On the exhale, you rotate the hips, the head, and the torso all at the same time. Use an exhale to bring yourself back up, lift the ankle up, unravel that rotation, and place the hip down. And then you would repeat that exercise on the other side. Now, things that you want to pay attention to are disparity through the two halves. One might feel like it's more of a stretch, the other might feel like it's more work. Or you might notice that you're limited in your range of motion in different segments of your body. All of that's okay. Over the course of time of practicing this, you're going to improve in your function. You're going to improve in your muscular balance. Now, as I reminded earlier, if you have difficulty stabilizing your pelvis, so if you found that you were swinging it out and you just can't bring it into that nice stable position, then we want to have you do what's called an assisted hip lift exercise. And so there's a link at the bottom of this video, and that would be your alternative. As with any exercise, if you find that it causes any old and symptomatic pain, it's not the right movement for you. That's your cue to find a local corrective exercise specialist and get a program put together that's unique for you. I hope that you enjoyed watching And if you have any questions, please reach out. I'm here to help. This is Deb Preachuk at Pain Free Posture, Minnesota. Thanks for watching.